Diabetes can cause problems during pregnancy, not only for the mothers, but for their unborn babies as well. Pregnant women with diabetes are at higher risk for complications, and their babies have an increased risk of birth defects. Proper health care before and during pregnancy can help prevent health problems for both. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week we're talking about diabetes and pregnancy and how St. Luke's Diabetes and Pregnancy Program helps patients manage their conditions before and during pregnancy. With me today is Dr. Devon Ramaeker, a St. Luke's Maternal-Fetal Medicine Specialist. Thank you so much for joining us today.
Thank you for having me.
So Dr. Ramaeker, can you explain the different types of diabetes and how those affect pregnancy?
Sure. So there are two large categories of diabetes that we can see in pregnancy. One category is called PreGestational diabetes, which includes type 1 and type 2, meaning women enter pregnancy with that diagnosis. And then diabetes that can occur or happen during pregnancy, which is called gestational diabetes. Type 1 diabetes is an autoimmune disorder where insulin's not made in the body. Type 2 is typically what's considered insulin resistance. So there is some insulin made, but it's not used effectively. And then gestational diabetes is similar to type 2 diabetes. It's a state of insulin resistance that occurs during pregnancy.
Okay, so let's start with pregestational diabetes. What are the risks for women who develop that?
For pregestational, which again is type 1 or type 2 diabetes, women can have difficulty managing their blood sugars, and that includes both low blood sugars and high blood sugars that can occur during pregnancy. For women with type 1 diabetes specifically, they can also develop diabetic ketoacidosis, which can be life-threatening if not treated appropriately. If women have eye or kidney-related damage due to pregestational diabetes, that can get worse in pregnancy. They can experience high blood pressure problems and have an increased risk of cesarean delivery.
Okay, now what about risk for mothers who develop gestational diabetes?
So those mothers also have an increased risk of high blood pressure problems like gestational hypertension or preeclampsia, and also carry an increased risk of C-section. The other very important factor to remember is that women that have gestational diabetes have a significantly higher risk of developing type 2 diabetes later in their life.
Okay, so when do patients typically start with the diabetes and pregnancy program?
So they can enter that program at any point during pregnancy or even prior to pregnancy. For women who have pregestational diabetes, which is type 1 or type 2, we encourage those women to see us prior to pregnancy to discuss their blood sugar management and optimize their blood sugar control prior to becoming pregnant. Otherwise, women can see us at really any point or any trimester whenever they are diagnosed with gestational diabetes, or as early as possible in pregnancy if they have type 1 or type 2 diabetes.
Okay, so how does the program help patients through their pregnancies?
So we offer a complement of nutritional counseling, discussion with an MFM physician about management of blood sugar control during pregnancy, and really continued care through the rest of their pregnancy. So they oftentimes will meet with one of our certified diabetes educators to discuss nutrition management, blood sugar monitoring, and then with an MFM physician who will go over those counseling pieces that we previously discussed. And then on a weekly basis, they actually review their blood sugars through our office, oftentimes remotely, and those blood sugars are reviewed by our certified diabetes educators and our nurse practitioners, and we keep a very close eye and management on the blood sugar control.
Okay, great. Well, is there anything else that you'd like to add today?
Just to really encourage moms with type 1 or type 2 diabetes to really seek out preconception counseling through a maternal-fetal medicine specialist prior to attempting conception. And then to also remember that women with gestational diabetes do have a significantly higher risk of developing type 2 diabetes, and so that should be followed up on after birth.
Okay, great. Well, thank you so much for joining us.
Thank you.
To learn more about St. Luke's Diabetes and Pregnancy program, visit stlukeskc.org/diabetes and pregnancy. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.